the numbers are showing, if you're not metabolically fit, if you've got comorbidities, you are very susceptible to the impacts of this virus. So it's really about empowering you as much as, combating the disease in terms of the physiology and the etiology of this disease. Because we don't need to be constantly locked in this fear and uncertainty that's gone on for months. Hi, today's Friday, July 17, 2020. And the reason I'm giving you the date is because early this week, I happened to be in my car with the radio going, and it coincided with a press conference given by California Governor Gavin Newsam on the COVID-19 pandemic situation in the state. And what struck me was he made this really defining statement of, until there's a vaccine or an effective treatment, he was going to impose these draconian measures of closing businesses, particularly restaurants, restricting movement, enforcing mask wearing with fines and even jail, etc. And he was going to do that anytime the numbers spike. And he was very definite about it. Now, I'm not against a vaccine. I'm not against effective treatments. I'm not wanting to be political or philosophical here. I just want to get out a point that is not being discussed at a national level. Because with Gavin Newsom's statement of until there's a vaccine or an effective treatment, or what I'm now paying attention and aware of because of that, I'm listening to this discussion in Georgia between the governor and the mayor. The mayor wants to impose mask wearing where the governor is recommending it, but doesn't want to impose a mandate. There's this national discussion about all these things like mask wearing and vaccines and effective treatments and social distancing, etc. And what struck me about all this, and it was that statement by the governor that really drove it home, is at this level, we're not having that same messaging about how you can take control of your health, and by doing so, can develop your immune system, because developing your immune system is one of the most effective ways we can combat COVID. And it's something every one of us can do and start on today, right? We can start it today, and it won't cost us anything. It might cost us a little bit more and maybe a little bit of better food choices, maybe some supplementation, especially things like vitamin D and zinc, vitamin C, if you're not taking them. But that investment is tiny compared to the costs that are being incurred with treating COVID when people actually have it, or prophylactically with a vaccine. These are, we're talking about billions of dollars, right? This is something you can take into your hands today and without a lot of cost move forward with. And in doing so, there's another important side effect, and it's the psychological, emotional one. All this messaging is keeping us at bay. It's putting the control in these messengers' hands, and it doesn't give us a sense of control. And that produces chronic stress and fear, because we're waiting for a vaccine, we're waiting for a treatment, because there's a lot of fear out there about this virus. When on the other hand, when we feel we can take control of our health and build our immune system so that if we do get exposed to COVID, our chances are much less of having a really serious outcome, that's going to land us in the hospital. A lot of people may get a very serious flu, but as the numbers are showing, while there's 15% on one end getting serious impacts from COVID, including dying, there's another 15 to 20% out there that are completely asymptomatic. And so which side of that spectrum do you want to be on? And obviously, those who are asymptomatic have healthy, robust immune systems and are metabolically fit, because the numbers are showing if you're not metabolically fit, if you've got comorbidities, you are very susceptible to the impacts of this virus. So it's really about empowering you as much as the, combating the disease in terms of the physiology and the etiology of this disease. Because we don't need to be constantly locked in this fear and uncertainty that's gone on for months. Because it's not only had a devastating effect on our economy, it's having a devastating effect on both our national and individual psyche. So the message today is the one that's not being given, and that is, you have something within your control, and it is your responsibility to be that best version of you, so that we can not only fight this COVID thing, we can end this discussion of national health. And talk is cheap. Let's quit talking and start being the best version of ourselves. And we're going to feel a lot better doing so, because we're not only going to feel better physically because we're in better shape, but emotionally and psychologically because we're taking away that fear and uncertainty and replacing it with confidence and action. And it's not only for our individual selves, but when we do this, we're also doing something for the greater good. Thanks very much.